OPES Health is a cutting-edge multi-specialty healthcare facility delivering many services, including podiatry. Here with details on how a podiatrist may be able to help you is Dr. Janelle Beckford from OPES Health. Good morning.
Good morning.
Welcome.
Thanks for having me.
So let's talk about podiatry because it's something I think people have heard of. They know maybe if they haven't had to go see a podiatrist yet, they may not know kind of everything that you cover, but kind of explain what podiatry is.
Okay. So podiatry is the field of medicine that's devoted to the study, diagnosis and treatment, both medically and surgically, of conditions related to the lower extremity, up to and including the foot and ankle.
Okay, so it's foot and ankle any further up, or is it just
all the way up? It's the entire lower extremity.
I didn't realize that. All right, so who do you typically, because you're actually a surgeon, correct?
I'm a podiatric surgeon, so I'm qualified to treat those conditions. My patients vary. Surgically, I might see a patient that needs more elective surgery versus emergent surgery.
Okay.
So that would vary from having a bunion procedure, hammer toe correction, a ruptured Achilles that might need a repair, or will need a repair rather, broken bone in the foot, to somebody that has a raging infection that might need a debridement or an amputation.
What's the most common procedure that you're doing, do you think, these days?
Probably still in the forefoot with respects to the bunions and hammer toes.
Okay.
It varies due to the different facilities I work at.
You were telling me that it's important that people should not ignore their feet, which
Absolutely.
Sometimes, I don't know what it is, but we tend to do that. Why is that? And why should we not ignore it? Why is it kind of a you know?
It's strange to me. I couldn't tell you why people do that, but for the most part, we need to remember that they're carrying us every single day, and the only time that we really pay any attention to them is when we're taking off our shoes and socks normally, and that's
or
in the
if they're
morning
hurting, and then all of a sudden there's a problem that.
Yeah, and it really is important to take care of your feet just as you take care of your eyes and your teeth.
How do you do that? Any tips for making sure that I know us ladies in heels, we can do damage to our own selves.
Checking our feet frequently. If there's any bruising, rubbing, calluses, if there's a pain, then you should probably check it out and come and see a podiatrist.
How do you do that? Do you need a referral to come and see you guys to see a podiatrist?
It varies depending on the insurance. Some insurances you don't need a referral and you can come straight in. Some you'll have to go to your primary care doctor and then they'll give you a referral to see us.
I know you mentioned diabetes as well, and I know people with diabetes, feet, from what I understand, a big issue as well. Do you see a lot of that? What
Absolutely.
Do you think, people should know?
I think for the most part with diabetes, whether you have a foot condition or not, it's important that you do come and see a podiatrist. They recommend that once a year that a podiatrist should see the patients that have diabetes, just to monitor and make sure that there's no changes. It's been studied that up to, well, actually more than 50% of diabetic amputations can be prevented if you have a podiatrist included in your healthcare team.
All right. Anybody else that should be seeing you on a regular basis, or is it really just the diabetes patients?
No, it varies. I see pediatric patients, and that might be for an ingrown toenail or growing pains, which might be a result of flat feet. I see athletes.
Is that a real thing?
Yes. Yeah.
Really? We need to do a whole segment on that.
I see athletes, both professional and weekend warriors.
Okay.
Say you've taken up running, for example. Runners often have pain with arch pain, heel pain, shin splints. We'll take them in, work them up, diagnose the problem and create a treatment plan.
So surgery, it doesn't always have to be a surgery. No. It could just be some other kind of treatment.
Yeah, we can do orthotics. There might be manipulation. There's other modalities that we use.
Well, again, we've talked about OPES Health a lot on the show. We love what you're doing and kind of the future of healthcare, kind of all in one here. If people have more questions, what would you have them do? How can they get in touch with you or your office?
Just give us a call over at OPES Health or check out our website.
There is the info there. Well, thank you so much. We really appreciate you having you on the show this morning, Doctor.
I appreciate it.
All right.